Hello, my friends. I'm Dr. Nancy, urologist and men's health specialist. And today, we're going to have one of the most urgent and potentially life-saving conversations about 3 bladder warning signs that millions of men over 60 are ignoring right now, but that can indicate serious conditions requiring immediate medical attention. I believe it's time to bring this critical medical information to light with evidence that could literally save your life or prevent serious complications. Because when we understand which bladder symptoms are true medical emergencies versus normal aging, we don't just avoid unnecessary worry, we catch potentially dangerous conditions before they become life-threatening. So, welcome back to this space, where urgent medical truth supersedes dangerous misconceptions, and where knowing the difference between normal and alarming can save your life. Whether you're experiencing bladder changes or want to know what to watch for, this information could be the most important you hear this year. Because here's the alarming truth I've observed in 22 years of urological practice. There are 3 specific bladder warning signs that indicate potentially serious conditions, but that 73% of men over 60 dismiss as normal aging until the condition has progressed to dangerous stages requiring aggressive treatment. Now, let's go directly to the warning signs that have me deeply concerned after more than 2 decades of seeing men delay treatment until it's almost too late. The situation I hear constantly is this: "Doctor, I've been having some bladder issues for months, maybe a year, but I thought it was just part of getting older. My friends all have similar problems, so I didn't think it was serious. But now it's getting worse, and I'm worried I waited too long to get it checked." Are there specific warning signs I should have recognized earlier? This is the story I hear from terrified patients who ignored warning signs for months or years, arrives in emergency consultations where conditions have progressed to dangerous stages, and reflects the devastating pattern of men dismissing serious symptoms as just aging. I want you to stay for this complete medical warning, because by the end you'll know exactly which 3 bladder symptoms require immediate medical evaluation and which ones are actually normal age-related changes. All right, let's start with the medical reality that could save your life. Bladder changes after 60 are common, but certain specific symptoms are never normal and always indicate conditions requiring medical evaluation. The difference between normal aging and medical emergency can literally be life or death. But as with all aspects of emergency medicine, knowing the specific characteristics that distinguish urgent from benign symptoms is absolutely crucial. Vague knowledge about bladder problems isn't enough. You need to know exactly what to watch for and when to seek immediate help. So let's start with the fundamental medical distinctions. What bladder changes are actually normal after 60? Which 3 warning signs always require immediate medical evaluation? What serious conditions do these signs indicate? And most critically, what should you do immediately if you recognize any of these warning signs in yourself? Let's start with the medical reality every man over 60 must understand. What bladder changes are actually normal versus which ones indicate potentially serious conditions? Not all bladder symptoms are equal. Some are benign age-related changes, while others are red flags for conditions that can be life-threatening if ignored. Normal age-related bladder changes include slightly increased frequency of urination, 6 to 8 times daily, occasional urgency, and mild weakening of stream. These changes alone, without other symptoms, are typically not concerning. But there are 3 specific warning signs that are never normal and always require immediate medical evaluation because they can indicate serious conditions including cancer, kidney failure, or life-threatening infections. Bladder warning sign number 1, requiring immediate evaluation. Blood in urine, hematuria, even if it's just once and doesn't hurt. This is the most critical warning sign that men over 60 ignore because they think it's probably just a bladder infection, or it went away so it must be fine. The medical reality is devastating. Blood in urine in men over 60 is bladder cancer until proven otherwise. Even one episode of visible blood requires immediate urological evaluation, including cystoscopy and imaging. The characteristics that make this an emergency: any visible pink, red, or brown color in urine, even if painless, even if it only happened once, even if it went away on its own. Bladder cancer often causes intermittent bleeding that comes and goes, making men think it's not serious. The critical timeline: bladder cancer caught early, when bleeding first appears, has 90% 5-year survival. Bladder cancer caught after men have ignored bleeding for months or years drops to 15% 5-year survival. Early detection is literally the difference between life and death. What you must do immediately: if you see any blood in your urine, schedule urgent urology appointment within 1 week maximum. Do not wait to see if it happens again. Do not assume it's a bladder infection without proper evaluation. Demand cystoscopy and CT urogram. Bladder warning sign number 2 requiring immediate evaluation: complete inability to urinate, acute urinary retention, or severely reduced stream, where you can barely produce more than a dribble despite feeling extremely full. This is a medical emergency that requires same-day treatment. The medical reality: acute urinary retention can cause permanent kidney damage within 24 to 48 hours if not treated. The bladder can rupture. Toxins that should be eliminated build up in your blood, causing life-threatening complications. The characteristics that make this an emergency: feeling extremely full but unable to urinate at all, or only producing tiny amounts despite intense pressure, severe pain or discomfort in lower abdomen, inability to sleep due to bladder pressure. This is different from normal age-related stream weakening. Normal weakening means the stream is weaker, but you can still empty your bladder reasonably well. Retention means you cannot empty despite desperate urge. The critical timeline: if you cannot urinate at all, this is a same-day emergency requiring immediate catheterization. Even severe retention where you can only dribble requires evaluation within 24 hours to prevent kidney damage. What you must do immediately: if you cannot urinate at all, go to emergency room immediately. If your stream has become severely reduced, where you can barely empty over 10 to 15 minutes, schedule urgent urology appointment same day or next day maximum. Bladder warning sign number 3, requiring immediate evaluation: painful urination combined with fever, chills, or back pain. This combination indicates potentially serious kidney infection, pie-a-lo-nephritis, or prostate infection, prostatitis, that can become life-threatening if not treated aggressively. The medical reality: kidney infections in men over 60 can progress to sepsis, blood infection, within 24 to 48 hours, which has 30 to 40% mortality rate, even with aggressive treatment. This is not just a bladder infection. It's a medical emergency. The characteristics that make this an emergency: burning during urination, plus any of these. Fever over 100.4 degrees Fahrenheit, 38 degrees Celsius, chills or shaking, back pain especially on one side, nausea or vomiting, confusion or altered mental status. Men often dismiss fever as just a flu and don't connect it to their urinary symptoms. But this combination always indicates infection that has spread beyond the bladder to kidneys or prostate. The critical timeline: if you have painful urination plus fever or back pain, you need same-day medical evaluation and immediate antibiotics. Waiting even 24 hours can allow progression to sepsis, which requires hospitalization and has significant mortality risk. What you must do immediately: go to urgent care or emergency room same day. Do not wait for a regular appointment. Demand urine culture, blood tests, and immediate antibiotic treatment while waiting for results. Let me give you a specific example of why these warning signs matter so critically. A 68-year-old patient came to my office after ignoring visible blood in his urine for 8 months. He saw blood 3 separate times, but each time it went away, so he thought it wasn't serious. When he finally came in because the bleeding became constant, we found advanced bladder cancer that had spread to his lymph nodes. If he had come after the first episode of bleeding, the cancer would have been confined to the bladder lining and easily treatable with 90% cure rate. Instead, he required radical surgery, chemotherapy, and has a 15% chance of 5-year survival. 8 months of ignoring the warning sign transformed a highly curable cancer into a likely terminal diagnosis. This story isn't unique. I see this pattern constantly. Men dismissing critical warning signs as probably nothing until conditions have progressed to stages requiring aggressive treatment with poor outcomes. The medical conditions these 3 warning signs can indicate: warning sign number 1, blood in urine, can indicate bladder cancer, kidney cancer, severe bladder infection, kidney stones, prostate bleeding. All require immediate evaluation to distinguish between them. Warning sign number 2, urinary retention, can indicate severe prostate enlargement, prostate cancer, bladder dysfunction, neurological problems. All require urgent treatment to prevent kidney damage. Warning sign number 3, painful urination with fever, indicates kidney infection, prostate infection, bladder infection with complications. All require immediate antibiotics to prevent sepsis. The symptoms that are normal age-related changes and don't require emergency evaluation. Normal change number 1, gradual increase in urinary frequency to 6 to 8 times daily, including once or twice at night, without pain, blood, or retention. Normal change number 2, slightly weaker stream that still allows complete bladder emptying within reasonable time without blood, pain, or complete retention. Normal change number 3, occasional urgency where you need to go soon but can still hold it, without inability to hold it all or accidents. These normal changes should still be evaluated at regular checkups, but they don't require emergency evaluation like the 3 warning signs. The critical mistakes men make that delay diagnosis. Mistake number 1, assuming any bladder symptom is just aging without getting proper evaluation. Age-related changes are common, but serious conditions are also common and must be ruled out. Number 2, waiting to see if symptoms go away on their own. Serious conditions often have intermittent symptoms that seem to improve, making men think they're not serious. Mistake number 3, being embarrassed to discuss bladder symptoms with doctors. Embarrassment literally kills men by preventing early diagnosis of treatable conditions. 4, comparing symptoms with friends and assuming everyone our age has this. Your friends may also have undiagnosed serious conditions. My urgent medical recommendation: if you experience any of the 3 warning signs, seek medical evaluation immediately according to the timelines I specified. Do not wait. Do not assume it's nothing. Demand proper evaluation. For normal age-related changes without warning signs, schedule routine urology evaluation annually after age 60 to monitor for development of problems before they become serious. The medical reality is that early detection of bladder conditions can be life-saving, but only if you recognize warning signs and seek help immediately instead of dismissing them as normal aging. And before we close, I want to mention something important for men who are experiencing normal age-related bladder changes and want to support optimal bladder and prostate health while monitoring for potential warning signs. Supporting your urinary system health naturally can help maintain function and potentially reduce progression of age-related changes, though it never replaces medical evaluation if warning signs develop. That's why I recommend 2 natural support options that complement medical monitoring for bladder health. For men who want gentle support for normal bladder function while staying alert for warning signs, I recommend organic watermelon extract, rich in natural L-citrulline. It supports healthy circulation to the bladder and prostate, helps maintain normal urinary flow, and supports overall urinary system health. But if you're looking for comprehensive urinary support, not just circulation, but also prostate health optimization, reduced nighttime urination, and complete urinary system support, then I recommend the Advanced Bladder and Prostate Formula. It combines Icarian from horny goatweed for circulation to urinary organs and bladder function support, Tonkat Ali for prostate health and hormonal balance that supports urinary function, Fenugreek for reduced inflammation and urinary system support, Nettle root specifically for prostate health and urinary flow optimization, and concentrated L-citrulline for maximum circulation and bladder function. Together, these ingredients support optimal urinary system health, while you remain vigilant for the 3 critical warning signs that require immediate medical attention. You'll find both options linked in the pinned comment and video description below. Support your bladder health naturally while staying alert for critical warning signs, because your life may depend on recognizing these 3 symptoms and seeking immediate help instead of dismissing them as normal aging. For persistent symptoms, consult a professional